So I had the opportunity to come visit Middletown. It's around springtime, so it was beautiful out. You drive down the highway, you see the hospital. It's kind of hard to miss, and I was very impressed.
It's almost like a college campus. There's trees, there's a nice lawn outside, and then once you get closer to the hospital, there's a nice parking lot. Everything is very clean. Actually, surrounding the parking lot, there's like a walkway where there's actually like exercise equipment and stuff. There's like the Zen garden, and there's koi fish in that little pond. So exactly what you'd want in a hospital. So my first impression was actually walking into the main lobby, and I see the guy playing the piano. So it was a good first impression.
Everything is very clean. Everything just seems very new and up to date.
Very comfortable, for a hospital setting. Felt very warm.
Once I started seeing the hospital, I really liked that the hospital is a state of the art. It's beautiful, it's clean, and I liked my interaction with both faculty and the residents.
In terms of food, there's the cafeteria downstairs, which is where most of us get our meals. Employees get a discount, which is nice. In terms of the other food places, there is Starbucks, which is in the outpatient building. And then in the main part of the building, there is Shack Full of Nuts.
We could park right in the garage, so we park super close to the ED. It's easy access, we're not walking far.
It's really nice. I park there all the time. There's always, a parking spot available.
And then we walk right over the bridge from the garage in the hospital, and the ED's right there. Keeps your car out of the rain, out of the snow in the wintertime, so it's awesome to have that. That's a huge advantage.
We have conference rooms where we do our weekly didactics, and they're really great. They're very updated, so we always have those.
The areas that I do like to hang out are the medical staff lounges. I think those are really nice, very comfortable, and they just are conducive to either relaxing or allowing me to get some of the work I need to get done.
The residents each have on-call rooms, so each residency has on-call rooms where they have like bunk beds, a shower, a computer in that room. So, if you're on like a long call or you're on an overnight shift, you have a place to go where you can kind of take your own time and like do notes. You can go to sleep if you're on overnight.
In terms of the sim lab, we have like practice sessions where we go through practice scenarios of something that could happen on the hospital floors, emergent cases and how we would handle it, in a more of a safer environment and, where it's a safe place to make mistakes, and then a learning component at the end of the sim lab as well.
OMT Clinic is here in the outpatient building. And I think for me going into PM&R, I really didn't want to lose my OMT skills that I learned in medical school. So that's actually one of the main reasons I chose this residency.
So the front of the emergency room, we have the ambulance bay, which brings you right into what we call the red zone. That's like our higher acuity section where we see like cardiac arrest, stroke patients, trauma patients. We have a couple big trauma bays in there for resuscitation. There are larger rooms where we try to limit the big room to one patient essentially, so we have plenty of room to work around if we're running a code or whatever resuscitation we're doing. We have all of our chest tube kits in there, we have central line kits in there, we have thoracotomy trays, we have like some surgical equipment for when the trauma surgeons need to come down for traumas, and pretty much everything you need to run a code will be in that room at that time. And then the helipad is right outside. It's like right next to the actual ambulance bay. So it's straight access right into the emergency room from there. And it's basically, the whole ED is like a big cube. So it's just a huge square, and eventually you come around to our pediatric section, and then it loops right back around to red zone. So it's just like a big square. In the center of the square, we have our imaging. So we have our CAT scan and our x-rays located there as well. We also have portable x-ray, so the x-ray techs can go around to the room, so we don't always have to bring a patient back there, but CAT scan, we bring patients right into the center of the ED there.
We have our second floor workroom, which is really nice, that only the surgical residents can use, and it has all computers, so it's a nice space for us to work in when the day gets busy. And then actually, in addition to, I also really like that we have a sim lab as well. So that's where we have our laparoscopic trainer, where we have different modules that help simulate different cases in the OR that we can practice on, not on real humans, and then be able to practice our skills in the operating room when we are doing cases. We do have 2 Da Vincis. One of them is a dual console, meaning that we have the one for the primary surgeon and one that's the teaching. So that's nice as residents, where we can flip back and forth between the attending doing the operation and us doing the operation. And then we do have a single console room as well for the Da Vinci. So we have 2 robots, which is really nice.
I would say come here without any reservations. This is one of the better programs that you can attend.
I do feel like this program is very supportive in growing, and residents in the 4 years that you spend here, you will not regret.
You're really integrated into everything you rotate in. You're not just like in the corner kind of getting by. You're really getting in there and learning, but in a way that's not overwhelming.
This is one of the places that I felt most comfortable on my rotations as a medical student. So I would definitely say, yeah, if you feel comfortable here, you bond well with the other residents, the nursing staff, the faculty, then I would 100% come here. It's a great learning environment. We see a lot of acute pathology. You're going to learn a lot. You're going to do a lot of procedures.
I just became a resident myself, and I look back and I'm like, wow, I'm really grateful and happy to be here. I really like the close-knit environment that we have, not only with my own respective residency program, but also within the hospital community.
I'd say absolutely. You know, it's everything that you could want here. You know, the friendly dynamic between the residents, between the attendings. You never feel left out to dry. You always feel like someone is, you know, supporting you. And then from the staff, you know, the nurses, the pharmacists, the clerks, even from the great cafeteria workers, everyone is so kind here and so welcoming and understanding. And it's just a great environment to be in. You know, I would never, you know, second guess my choice at all.